In order to add any special type of test, such as outcome measurement tool tests, selected orthopedic or other type tests, you can do that under the selected tests. So we are now under the underlying impairments page of the evaluation. Under the range of motion and strength, it says selected test. Click select objective test on the right. Now it's going to open up and you have a long list of different tests that you could use with your patient. You can search by the name. So under search at the top here, if I wrote Berg, here's the Berg. I click on it. So it's highlighted, and then add selected test. Now that test is on the line. So now for the Berg, for example, if I wanted to fill it out, I click the first button on the line that looks like a white piece of paper with a pen. I click that. It now opens up the categories of that test. So each category line has the values of that specific test built in. So I can come in, fill the test out. Once I fill it out, I close it. It will then calculate the score on the test for me. One nice feature is for a lot of the tests, and it's not available for all of them, but for a lot of them it's available, where you see the score. The third button that looks like a white piece of paper, if I click it, the system will automatically write for me an interpretation statement about what that test score means. Now, for some of the tests, like if I click select objective test again, some of the tests, let's say the 30-second chair stand. These are tests that are not like questionnaire type tests. So when you open these type of tests, so the 30-second chair stand, I click the first button to open it up. It lets you put in a date and time that you did the test, number of time the patient came to full standing position in 30 seconds, number of time patient stands in 30 seconds. So however you do this test, you can put in the date, the time that you did the test, and then the number of times either they came to full standing, or if you did it without a full standing requirement, you can put in that number. And then that will be saved. Now, for these kind of tests, because there are multiple areas, it's not a cumulative kind of a scoring, but it had multiple things I could type in. There's just no reason or no area here or enough area to put in the full information on this little area of this side of the test. So for those tests, you will not see a box with a score because there was different sections of that test that we can't put in all the sections in this little area here on the screen. So for those, when you do print out the test, it will all be there. But when you're looking at the screen, you will not see it written. But if I open the test back up, the scores are there, and I can update it in a future progress or recertification type note. But it will also, when I print out the note, the score of that test would be there on the printed version. You just can't view it. There's just not enough room on the screen to view that kind of information.